Okay, so acute diarrheal disease is the most frequent gastrointestinal disorder and the main cause of dehydration in childhood. Also, it is characteristic by a sudden occurrence of 3 or more watery or loose stools daily. In addition, the initial phase of the disease is often accompanied by anorexia, throw up, abdominal pain, and a high body temperature. The most common etiological agents that we have here in Colombia are two, and the first one is a virus we call rotavirus, and the second one is a bacteria that we call Escherichia coli. There are other pathogens such as Cryptosporidium and Shigella species that may also be important to cause the disease, but the most important two here in Colombia are those. Also, moderate to severe diarrhea in low-income countries are frequently, so it's important to know what etiological agents are causing this disease. We have 4 signs of alarm. First one is unconscious. Second one, dehydration. Third one, sucking eyes. And fourth one, that the child can drink, or if the child could drink, do it, but with difficulty. So if the child presents one of those things of alarm, we have to go with our child to our emergency service to the doctors treat the disease. So the most important thing to this disease are the prevention. So first recommendation is access to safe drinking water. The second one, use of improved sanitation, hand washing with soap, good hand washing with soap or maybe with antibacterial, exclusive breastfeeding for the first 6 months of life, good personal and food hygiene, health education about how infections spread, because there is so important. And the most important one is the vaccination, because we have to go with our child to get the rotavirus vaccination. Here in Colombia, we apply that vaccination at the age of 2, 4, and 6 months. So it's important to get those. Now we want to tell you about a personal experience that we had in practice. So we have a patient of 6 months of age who enters the emergency department with a clinical picture of fever higher than 38 degrees, nasal flaring with respiratory distress, irritability, wheezing, doesn't accept food, is managed in the service. The following day she is hospitalized due to poor management of the health personnel because she was given a water requirement greater than she needs, higher than she needs. So her situation get worse because that affect the lungs. So with the water overload administered, we have to pass a tube to her that called emergency thorax to eliminate the excess fluid. She was given antibiotic treatment and she was taken to the UCE service, where she received more comprehensive and strict care. The patient recovered from the situation, giving herself home treatment, but now she is the patient that currently go to the emergency service for respiratory symptoms. So it's important to know all the education that we can about this disease to prevent it. And basically the conclusions that we have, we want to give, is that the child is so important, and the care doesn't base in a treatment or something like that. It's also helped the child to improve in their disease, so they can fulfill their dreams without anything stop them. And also it's very important to prevent this disease, so if you can focus on the prevention, that would be amazing. So thanks so much for watching this.